Hi, everyone, and welcome. Welcome to this technical assistance presentation. My name is Dr. Jacqueline Christensen. I am the Vice President of Quality Research and Evaluation with School-Based Health Alliance. You are in technical assistance session on Tuesday, the 28th at 11 a.m. This workshop has been approved for continuing education through the Community Health Center Incorporated and its Weitzman Institute. Presenters are required to disclose any relevant financial relationships for CE activities. Our presenter today is Dr. Kathleen Tebb at University of San Francisco. And this particular presentation is the development, evaluation, and implementation of Health EU or Saluti 2 to promote adolescent-centered contraceptive care. So I am going to turn it over to Dr. Tebb. Let me remove this right now and we can get the slides up here. And she will read the learning objectives for today and I will turn it over. Go ahead.
Wonderful. Thank you so much, Jacqueline. So as Jacqueline said, I'm Kathleen Tebb. I'm a developmental and health research psychologist at the University of California, San Francisco. And I'm here today to share with you some information about the development, evaluation, and implementation of an app that I developed in partnership with school-based health centers and community-based organizations called Healthy You Saluti 2. And its goal is to promote adolescent-centered contraceptive care. I don't have anything to disclose, and I'm just going to read you the objectives today. By the end of this session, you'll be able to describe key features of the Healthy You Saluti 2 app. Jacqueline, I'm seeing in the chat that two people cannot hear audio. Before I continue, I want to make sure that everybody can hear. So, okay, Mia can hear. And Jacqueline is going to try and figure out why some folks can't hear. Jacqueline, should I just continue? Or should I pause for just a moment? I think we have plenty of time.
Yeah, we do have time. It seems like the majority can hear, but I'm going to type into the chat because it wouldn't help if I say it for those who can't hear. That for those that can't hear the audio, to go ahead and try to leave and come back in, because sometimes it's just maybe they were on and then when it adjusted for us going live, for some reason it didn't connect the audio right. So I'm just going to type try leaving and coming back and see if that helps. And just let us know when you come back in if you can hear anything. All right.
So I appreciate folks' patience. For those who can hear, we'll just give it a quick moment to let folks who are having difficulty hearing sign out and come back in to join us.
Yeah.
And then I'll just reread the objectives as soon as folks come back in.
Okay, so we'll see how that goes. Yeah, so just give us a couple moments, folks.
Okay, some people say that it's working now.
Hooray!
So I think we're good to go then.
I think so. Okay, wonderful.
All right. Well, thanks
everyone.
I really appreciate you sharing that you can hear and that you're back on. So that's wonderful. So by the end of today's session, you'll be able to describe key features of the Healthy You Saluti 2 app. You'll be able to explain how the app promotes contraceptive care for adolescents, and you will be able to utilize the app in your clinical practice if you choose to do so. So before I continue, I just want to acknowledge my incredible multidisciplinary team of investigators at the University of California, San Francisco, as well as UCLA, and of course, my community partners at the Los Angeles Trust for Children's Health, the California School Based Health Alliance, and my amazing partners at the National Alliance of School Based Health, including our National Youth Advisory Board. We also are partnering with 28 school based health centers across 10 states at this point. And this project is funded through a patient centered outcome research institute dissemination and implementation award. So that's PCORI for those who are familiar with them. So, just to give you a little bit of background, as most of you all know, along with the upstream factors that influence adolescent pregnancy, compared to older women, adolescents' knowledge of contraception is often poor. And our team and others have found that they often perceive the number of contraceptive options to be confusing and somewhat overwhelming. They also often face issues of stigma and discomfort in discussing sexual health with their clinician, which further exacerbates barriers to care. And while teens often want to discuss sexual health with their clinician, they are often reluctant to bring it up themselves. And then from the clinician side, many often lack the time, comfort, or skill to provide comprehensive contraceptive care, especially in the context of a non reproductive related visit. So, to tackle these issues, we've used a social justice framework that recognizes that sexual and reproductive health information and access to contraception is a fundamental and basic human right. Our approach emphasizes the need for adolescents to have choice and personal agency in selecting a method of contraception, especially given the tragic history of contraceptive coercion among women of color and young women in the US. At the same time, all women need access to the full range of options so they can fully exercise their right to choose a method that works well for them. And I think in light of the recent Supreme Court ruling, access and promotion of contraceptive care is now more important than ever. So when I first began this project, there were only a couple of interactive web-based contraceptive decision support tools, and many of them had not been based in evidence, and many of them showed some changes in knowledge, but not changes in actual behavior or use of contraception. So we conducted some exploratory focus groups with adolescents, and at the time, they told us that the websites were confusing, the way that the options were presented were overwhelming and geared for older women. Um, and then, of course, over time, there have been few additional tools that have been evaluated, but again, their success has been limited. So we developed Healthy You Saluti 2 to support both adolescents and clinicians. Healthy You is an interactive, individually tailored, web based mobile health application. So, since it exists on a web based platform, it does not have to be downloaded for use and it can be used on any device with internet access. So, smartphone, a PC, a laptop, or a tablet. It's in English and Spanish with audio features to support low literacy populations, and it incorporates elements of digital empathy to enhance usability. It's designed to increase adolescents' knowledge, self efficacy, and to support patient centered contraceptive services that ultimately are aimed at reducing unintended pregnancy. For clinicians, it aims to make the visit more efficient and effective by offloading basic contraceptive counseling to the computer. The app also generates a patient summary for the clinician to review prior to the visit, which is they can then use to tailor the visit and support the delivery of patient-centered contraceptive care. So, this tool was developed with a strong partnership of adolescents, clinicians, community-based organizations, and of course, our school-based health partners. We had advisory boards with youth and community members. We conducted focus groups, interviews, a series of usability testing, and then we conducted pilot testing at school-based health centers in Northern and Southern California. Yeah. The engagement process was iterative in nature and ultimately led to a tool that was designed to meet the needs of various community partners through the engagement of adolescents and clinician. So this slide shows some photographs of the youth engagement process that we took in developing the videos that are embedded in the app. So as you'll see, I'm going to show you a demo of the app in a little bit, but we had adolescents serve as writers, as directors, as filmmakers, as producers. And then at the end of the sessions, when they finished the videos, we hosted an Oscar award party for them where we distributed miniature Oscar awards for each youth who participated and acknowledged their role. It was really just such a fun and great practice. And I think it also lends to the credibility and authenticity of the content. So once we finished our pilot testing, we conducted our cluster randomized controlled trial at 18 school-based health centers in Los Angeles County, and we enrolled 1,360 sexually active Latina adolescents. And this trial showed that the app, compared to controls, adolescents who used the app demonstrated significant increases in pre-post knowledge, self-efficacy, and actual use of contraception. So the baseline contraceptive use in our study was quite low. Only 29% of adolescents reported using a form of effective contraception prior to using the app. This increased to 63% for app users versus 44% in controls. And this increase was demonstrated at a 3-month follow-up and sustained over a 6-month follow-up, which is the duration of the study that we conducted. Now, keep in mind that all of these adolescents were utilizing school-based health centers. So they were coming into the school-based health center for care. So we would expect to see an increase in the participants at the control clinics. What we were surprised to see was such a dramatic difference among app users at the school-based health centers. So this ultimately was a 118% increase for app users compared to that 45% versus controls. Rates of discussing birth control with the clinician were also higher for app users, 89% versus 69% with controls, though this was just shy of reaching statistical significance, which was set as a p-value of less than 0.05. And part of the reason, even though this is such a dramatic difference, we controlled for a number of factors, such as reason for visit, and a number of other factors, baseline contraceptive use, so on and so forth. We also found that there was high satisfaction from both the clinicians and adolescents. Among surveys of clinicians, 83% reported that they felt the app engaged teens in the contraceptive decision-making process. 75% said the app helps them to provide more individually tailored discussions on contraception. For teens, almost all of them, 93%, said they understood the information on the app. 87% said the app gave them useful birth control information. 85% would recommend the app to a friend. And 70% reported the app improved the overall quality of their healthcare visit. And this study was published in the Journal of Contraception, which the reference is there for those who are interested. So clinicians, we gathered a number of testimonials from providers to get their take on how the app worked for them, and they said things like, "Having the app really helps me out, especially when I'm busy. When my students finish, they already have a list of informed questions. This makes my counseling visit more productive and a lot shorter." Another clinician said, "The app has reduced waiting time for patients because I'm able to expedite the visit, having already identified what works best for them in terms of birth control." And another said, "The Healthy You app gives our patients the ability to learn information they might be too shy to ask about. It also helps with the efficiency of the clinic by providing our patients with background information. It empowers them to ask us more questions because they are already a little more knowledgeable about the subject of birth control after using the app." Adolescents said things like, "It's helpful because if you don't know what you want, you're going to know what you want by the end of the video." The videos were some of the features that the adolescents seemed to like the most about the app. And so now what I'd like to do is turn it over to Jacqueline who has a demo uploaded on her computer and can share that with you. It's just a few minute clip, and I think it'll give you a better sense of the look and feel of the app. And I have to credit my amazing intern, Audrey, who's a member of the National School-Based Health Advisory Board and also is now working with us as a formal intern.
Salud Itu is an interactive web-based mobile health application to support adolescents and young adults in learning about sexual and reproductive health and supports patient-centered healthcare. The app is designed to be used prior to the healthcare visit to prepare the patient and provider prior to the face-to-face encounter. The main features of the app is to support sexually active adolescent females make decisions about their contraceptive use, though it includes content to support the sexual and reproductive health of all adolescents. It is in English and Spanish and has audio-visual features to support youth with low literacy and incorporates elements of digital empathy to engage youth. The app was developed in partnership with the adolescents, providers, and community and school health partners. To begin, they are asked a few brief questions to tailor the app to their needs. For instance, sexually active adolescent females are routed to the Contraception Decision Support branch of the app, which begins with 7 Mythbusters to assess knowledge with tailored feedback. For example, as long as the male partner pulls out before he ejaculates, the female will not get pregnant. Correct, you busted this myth. Pulling out or withdrawal method is not effective. Many women become pregnant because males release pre-ejaculation fluid that contains sperm. A man cannot control the release of this fluid. Or, birth control pills begin working as soon as you start taking them. Busted. The real truth is it takes time for your body to adjust to the hormones in the pill. Use a backup method for the first 7 days after starting the pill. A barrier method like the condom works immediately. Make sure you talk to your medical provider about when the method you choose will start working. It then asks a series of lifestyle and attitude questions that are important when selecting contraception. For example, when I have sex, it is important for me to use a method that works best for preventing pregnancy. Strongly agree, agree a little, disagree a little, or strongly disagree. It also asks about contraceptive use history. For example, what did you use to prevent pregnancy? Select all that apply. If they select one of the methods, they are then asked about their satisfaction with that method and how easy it is to adhere to that method. Based on the user's input, the app generates personalized recommendations, noted with a star on the list of methods presented, according to the Centers for Disease Control and World Health Organization method efficacy data. Users can then learn about the recommended method or any other method of interest. Each method has a brief description of why it is a top choice and challenges, with brief video vignettes of a provider and an adolescent talking about the particular method. After reviewing the method, the user can go back and review additional methods. Another unique feature of the app is that it generates in real time a summary of information gathered on the app to be shared confidentially with the provider. All participants receive messaging about emergency contraception and condom use. Non-sexually active youth, or youth who identify as other than female, are directed to a page where they can select any number of sexual health topics that they would like to learn about. Again, a summary with the confidential information they provided is generated for their healthcare provider. Our research showed the app significantly improved knowledge, self-efficacy, and agency in selecting a contraceptive method. Use of effective contraception increased by 118% for app users compared to just 45% among controls. Providers and adolescents reported high satisfaction with the app. The app on average takes about 10 minutes to complete. Please contact us to learn more.
Thank you, Jacqueline. So again, I want to thank Audrey Gabriel for producing and narrating that video. I think she did a really outstanding job. It's amazing the talent of our young people. So now where we're at with the app is we're trying to see if we can replicate some of the findings that we had in our cluster randomized control trial. So through the PCORI Dissemination and Implementation Award, we are now expanding it to additional school-based health clinics. We started the control period last year, and part of our clinics will begin implementation in the fall. So basically what is involved is clinics offer the adolescent a link to use the app. It's either a direct link or via a QR code prior to the visit. Adolescents can use this link on any device with internet connection prior to the visit. It could be done same day while they're in the clinic waiting room, or if they are given the link prior to the visit, they can do it at any location that's convenient for them, as long as they have that internet access. When completed, the teen must consent to share the information with the clinician. So to give you an idea of what that looks like, I wanted to share with you a screenshot of what that sample consent looks. And I apologize, the screenshot is a little bit blurry, but I'll read it for you. Basically, it says, "Thank you for using the app." It gives a brief summary of the information that they provided to the app and what the app generated for them. And then it says, "If you would like your healthcare provider to receive this summary through a secure email, please enter the following information. This is completely confidential and is kept private between you and your healthcare provider. Enter only what you are comfortable with. This will only be used to support your healthcare. If you do not want to share this information with your provider, please touch the next button below." And then they are given a space to provide their cell phone, their first name, and the first letter of their last name. And that's just to really ensure that the correct patient's information gets routed to the correct clinician. And whoops, I'm sorry, it advanced too quickly there. So what the clinician then sees is a confidential use report. Data is stored in the UCSF backend Salesforce system and is programmed to pull summary data from this Salesforce system in real time as the team completes the app. It then generates a secure email, which is sent to a designated clinic email or multiple emails from the clinic. So the clinics provide their emails to me prior to using the app, and that gets inputted into the back end system of the app, and then it's generated when the team uses it. The summary report contains the patient's name and or cell number, depending on what they entered in that consent page, their gender identity, reason for the visit, if they ever had sex, the type of sexual contact they had, what, if any, contraceptive they're currently using, the contraceptive method that the app recommended, and the method that the patient said that they are most interested in using after they completed the app. It also provides any potential contraindications that should be discussed further with the patient. That's not factored into the contraceptive algorithm in selecting a recommended method, but it's just sort of flagged for the provider to review. For patients who did not complete the contraceptive decision support pathway, the report includes a list of topics that the patient explored on the app. And this really is a very secure system. We take patient data and security very seriously, and it's the same system that UCSF uses for their HIPAA, all their HIPAA compliance. So it Healthy U has a Drupal web-based interface for those of you who are a little more techie. And the data, as I mentioned, is hosted on the UCSF Salesforce platform, which is updated and maintained by the UCSF Information Technology Services team, who ensures that strict data security standards are met at all times. It's double firewall protected, and they use industry standard encryption to protect data from the user's device. So only authorized UCSF personnel have access to this. And as I mentioned, all of the security is HIPAA compliant. As adolescents complete the app, they are offered an opportunity to give it a rating using a 5-star rating system, and then they can provide any additional comments that they want to share to give us additional feedback on their experience. And then, as Audrey mentioned in the video, the app concludes with a slide that says, thank you again for using this app. Feel free to discuss any of your questions with your healthcare provider. And then a reminder that if you have sex, always use a condom to protect yourself from STIs and HIV. Talk to your healthcare provider about contraception, including emergency contraception and Plan B. So, as we've been working with our community partners to figure out what is really going to be essential to implement this into wider clinical practice, there are a few lessons that we've learned. We feel that a team approach is ideal. I coined the term an ACT team, which stands for Adolescent Care Teams. That includes representation from all clinic staff, clinicians, the clinic manager, medical assistants, and the front desk staff. And this is important because clinics need to identify who and how they will distribute the link or the QR codes. For instance, at some of our sites, they're handing out small business cards, or they have a sign at the front desk or in the bathrooms with a QR code that the teens can just take a picture of. Some sites send the link out to the teen along with their appointment reminder, so it can be done in a number of different ways. You do need to contact me if you're interested in using the app, so we can get that designated secure clinic email and talk about integration into your clinical workflows. And then you get you'll be able to get the link to use the app. There are just really basic system needs. Wi-Fi and internet access is essential, and the app is available at no cost to any school-based health center that wants to use it. UCSF is in the process of licensing the app, but I made it very clear that I want this to always be free of charge to our incredible school-based healthcare settings and any other nonprofit clinics, larger healthcare systems that might be available at a cost, just to help with ongoing maintenance and upgrades. So here's my contact information, and you can also learn more information and access links to the articles on our website, which is healthyuinfo.ucsf.edu. And I wish there was an opportunity to hear your voices and have an interactive discussion, but I would love to see if you have questions. Please put it in the chat, and we will address those. So can the app be downloaded on a mobile phone anywhere? What's great about this app, thank you, Stephen, for raising that question, is that it's web-based, so it actually doesn't have to be downloaded. We got feedback from adolescents that unlike some native apps that you download from Google Play or the Apple website, it leaves that app on the phone, and that could potentially compromise their confidentiality. So because it's web-based, they can use it on their phone anywhere at any time as long as they have internet access, and then it's gone. They don't have a permanent record of that app or their usage on their phone. So hopefully that answers your question. There's a great...
This one's a little long, the next question.
Okay. Do you want to read it, Jacqueline?
Yeah, I can find. I tried to put it up here, but it gets cut off, so I'll just try to read it. So, with the recent Roe court decision, there has been a lot of push for people to delete period tracking apps and keep contraceptive data private because should someone be prosecuted for having an abortion in a state where it's illegal, that data can be subpoenaed and used against them to show evidence of sexual activity. I'm wondering if the info from this app would count as part of the healthcare visit and medical record. Otherwise, I do worry about how confidential it truly is. And I think it ties a little bit to your point about it going away from their phone, but how is it integrated into medical record?
So it's really up to each individual clinic site as to how they want to integrate it into their medical record, or if they even want to integrate it into their medical record. I've done, for those of you who are a little bit familiar with my work, I've done a lot of work on adolescent confidentiality. So it's a very important topic to me. Um, I worked with Kaiser Permanente to get a confidential stamp onto their records in Kaiser Northern California to prevent the issuance of explanation of benefits to the primary policy holder. So there's a number of things that clinics, need and can do to protect patient confidentiality. This can be uploaded as a PDF into their notes or into their electronic medical record, or the clinician can just review the information and then destroy it. So really it's up to each individual site. And I am so grateful that you are all thinking about the important ways that we need to continue to be vigilant in our efforts to protect adolescent confidentiality. So thank you for that, Mia. And I don't mind it being a long question at all.
All right, here's another one. Have you had a situation where an adolescent fills out the app info and doesn't have a scheduled appointment, and how do you approach that?
So that has not happened to date, to my knowledge. However, if the clinicians receive that confidential summary with that patient's number and their partial name, then they can do the follow up necessary to reach out to that patient and bring them back in for an appointment. So that's just kind of standard best practice care. And then the clinics, you would follow your normal protocol for rescheduling them if you have a no-show for a particular appointment.
Okay. To Lee's question, where can we find the slides that are used by the presenters? We will have those available. I don't want to make a promise on time yet because we're working on downloading. They've been sending them to us in advance. We're hoping in July to at least have the slides available. But again, definitely, I would say sometime in August, we'll try to have the videos available too that's recorded of the session. If you guys have any other questions, we have until 12 technically. So I'll keep it open for that. I'll
And I
ask
did
you. Oh,
Yeah, I did want to give plenty of time for questions.
Yeah.
And also, if anyone is interested in using this, like I said, it is free of charge right now. Please contact me. My email is there, kathleen.teb@ucsf.edu. And I'm happy to schedule a meeting where you could, if you're a little bit unsure if you want to use it or not, that's totally fine. I can give you more information. We can go through the app in more detail, or if you're ready to go, we can schedule trainings and just really give you the support that you need. While I have this PCORI funding, it's an opportunity to leverage that so I can give you free technical assistance and training.
That's really great. Yeah, I mean, as you were speaking, I had questions about the scalability of the whole program, because sometimes it's one thing to do a thing in a research study, it's a whole other thing to say, hey, nationally, here we go, right? We want this used all over. If folks do contact you, do you have just sort of a brief like informational flyer or worksheet or something like that folks can use to like talk to their teams about it?
To talk to their teams?
To their teams, like their
To their
staff. Like
teams,
if
yeah.
they had to bring the information back, is there a sort of a quick sheet or a quick guide overview? Or if they go to the website, what's going to be the best way for them to just say, hey,
Yeah.
this is something I heard about?
Sure, sure. We don't have a one pager on it. We do have the website, and I do have an implementation manual, which probably goes into much more depth than any site needs. But we can certainly pull some of that and create a one pager if folks are interested in that. We also, I want to just share hot off the press. We just got a small pilot award to collaborate with Jennifer Salerno's um, RAPS electronic screening
Mm.
tool.
Hmm.
And we're going to be integrating the Healthy You app with her electronic screener and then integrating that into the data exchange at the Los Angeles Trust for Children's Health and pilot testing that out in a couple of clinics this year. So if any of you are using the RAP screener, that's something that you can look forward to down the road as having this be a support tool as part of that system.
And then, were you guys thinking of doing anything else more targeted to male teenagers?
Thank you for raising that. So we do have some content on the app, as Audrey Gabriel said in the video demo. So there's the contraceptive decision support pathway, and for those adolescents who that information's not necessarily applicable, they can go to a menu and review a number of different health topics.
Mm-hmm.
Right now, those are more static in nature, meaning that they're just more uploaded information
Yeah.
and tips. But I'm working with Dr. Arik Marcel out of Johns Hopkins University, and we just submitted a grant. We submitted a grant, it got scored, and it's on the borderline funding. So we're waiting to hear if that's going to get funded or if we need to resubmit. But basically, we want to build out that content so it's much more friendly, youth
Yeah.
friendly, that it's really gender inclusive.
Yes.
To incorporate that in a very just to really meet the needs of more teens. And then I'm also working with another partner to develop an offshoot of this for adolescents and young adults with disabilities.
Oh,
Um, so,
fabulous.
so we just put in a grant for that. It wouldn't be part of this, but it would require a slightly different build. But those are the offshoots that we're working for, because we really realize that there's just such a tremendous unmet need for male adolescents, LGBTQ adolescents, and adolescents with disabilities. There's nothing out there for them. So
There's not a lot out there, and I think it can be really empowering for them. And I think, what you might be seeing with this app is that it's very empowering for the young women who are using the app, right, to feel in control of their sexual health. And I think continuing that conversation to say, hey guys, you can be part of this conversation too, and being responsible for what's happening in your sexual health.
absolutely.
And then you and I can have a conversation a separate time. I have someone who came up with curriculum for young adults with developmental disabilities, and sexual
Is it
health.
with the Flash curriculum?
No, she was at UCLA.
Okay.
We can connect, but
Thank
I
you.
want to make sure we can get to some of these other questions. So one other, Rachel says, in what format does the completed survey information come to the clinic?
Oh, so it comes in as a PDF. So the data is pulled in real time and it is emailed it comes from a secure UCSF email. And so the email that the clinic provides also needs to be secure. And it can be either printed for the clinician, it can be forwarded to the clinician, or it can be uploaded to their EMR, depending on how. That information, what that individual clinic decides.
Great, thank you. And then just thinking about how you set up the randomized control trial study, what was what happened with the control group?
So the control group received a sort of standard sexual health questionnaire. They didn't get any information, but they got whatever standard of care that the control clinics were providing. So most, school-based health centers do a really good job providing contraceptive care. But what we found was that a lot of adolescents weren't sharing or disclosing their sexual history, they often report that they feel more comfortable disclosing that information to a computer. Even if they know that that information is going to be shared with the clinician, they still feel more comfortable sharing it with the computer. And and what we also found was that in non-reproductive health visits, adolescents weren't being asked about sexual health, often because the focus of the visit isn't geared towards that, right? They're focusing
Right.
on the problem or the issue at hand. So by identifying adolescents in need, we can take advantage of a potential missed opportunity in those non-reproductive health visits. I see Lee's question. I have to just follow up with this. Are there plans to incorporate information on sexually transmitted infections? And I just want to share that this app actually began with an app that I developed to facilitate screening for chlamydia infections, and that was done in urgent care settings in both Kaiser and acute care community FQHC hospital settings. We do have some information about STIs. That's one of the additional build outs that we want to do. One of the tensions that we have, and I think it's true not just with this, but with any mobile health technologies, especially if they're being used within the context of a clinical setting, if the adolescents, and many of them do, use it on site prior to their visit, you have to balance the amount of content with how much time it's going to take adolescents to complete the app. And we found that ours takes about 10 minutes, a little bit less than 10 minutes to complete. And so that seems to be a feasible time while that adolescents can do while they wait. But if they have the access to the app, maybe they use parts of it in the clinic and then they can go back to it and revisit other content areas later after the visit, or the clinician can say, hey, to learn more, you can go and explore these additional topics. So these are all things that we hope to learn from all of you who start implementing the app in terms of what's needed, how can we add and build content that supports both your work as well as empowers the teens to explore and get information that's evidence-based and comprehensive in a way that's attractive and supportive for them. So thank you for raising that question.
All right. Are there any other questions that folks have? I think a few folks may have joined us a little late, which is fine. Welcome. But I just want to give folks a few more minutes. If you guys have any other questions about using this app, I think it's so fabulous that it is available to all of the school-based health centers, which is just fabulous. That if you guys are interested in using it, you just reach out to Dr. Teb and she can help you with that. Let's see, we have. I'm glad, Lee, that you're looking forward to incorporation with the wraps. Let's see. Not 100% sure how to ask this. We have primary care clinics as well as school-based health centers. Should we use at the non-SBHC clinics if the age group is appropriate?
I would love to have some early adopters in primary care clinics to see how this works in those settings. My former fellow is now at the University of Kentucky in their teen clinic, and I'm meeting with her on Friday of this week to get it integrated into their primary care clinic. So if you are interested in that, I welcome the opportunity. I think we have a lot to learn, and I don't see any reason why it can't be used in primary care settings.
Wonderful. Thank you.
And again, now's a great time given given both the Supreme Court's decision, but also the fact that we can leverage the funding that I currently have to really give you the support to get this up and going.
Mm-hmm. Yeah, I'm trying to figure out how we can tell everybody all at once. I think this is a great platform. We have about 49 people on this right now.
Oh, wonderful. Well, I
Um,
really do hope to hear from you all. This has been my passion project, and I'm just so grateful that PCORI has provided some additional resources to take it outside of the research setting and to actually try and get it into wider practice.
mhm. All right, I'll give folks another minute or so if you guys have any questions, and if not, then we'll wrap up. But thank you so much.
Oh, I'm so grateful for everybody who attended today. Thank you so much for sharing your time with me and for taking time to listen and learn. And again, I'm sorry I can't see your faces and hear your voices, but maybe at the next conference we'll be in person. Who knows?
There's Paula. Thank you, Paula. She says, thank you for sharing. Lots of thank yous, which is wonderful. All right, well, I'm going to shift back over to this view. And just say, as we start to wrap up here, and again, we're not gone yet. So if you do have any other questions, we can take another question. But if you are getting continuing education, please make sure that you use the link that is on our homepage to complete the evaluation. It's on the main screen. Additionally, I want to remind folks, let me close this one out real quick, that if you have not already, if your site has not already, please do complete our census. It is currently in process. Probably somebody from your location has received an email about it, but we are giving out incentives right now for folks who complete the survey. We're giving out gift cards. We're having a little bit of competition for those who, for states who really ramp up completing up the survey. So please remember to do that if you want to do it today, if you want to do it tomorrow, if you need, to take a break and you say, on my break, I'd like to fill out the census. That'd be awesome. So please remember to do that if you have not already. Any other questions before we wrap up?
Well, maybe folks can use this to just do a little bit of self-care before they move on to the next session.
Yeah, you got 10 minutes to 13. Yeah, go get some water, go get some sunshine, do some toe touches, something. And then we will see you at the plenary at noon, which should be really great. It seems like it'll be really thought-provoking today. So I'm excited. I can give you the title. It's I wrote it down. It's Culture Wars and Common Ground, Finding a Way Forward. So that'll be today at noon. And that's by folks from the Frameworks Institute. All right. Thank you all so much. Take care. Thank you so much, Dr. Teb. That was really awesome. I'm inspired now, and I want to go give this app to everybody. So thank you.
All right. Take care, everyone. Bye-bye.
Take care. Bye.